You can run a 10K, have absolutely no symptoms, and feel fantastic while a widowmaker blockage is growing inside you. How is this possible? Because biology doesn't care how fast you can run. Your body is so good at adapting that it can hide a 90% blockage and keep your blood flowing perfectly right up until the second it stops. That is why, for half of all men, the very first symptom of heart disease isn't pain, but sudden cardiac death. In this video, I will show you why the healthy heart fails, how your body hides these ticking time bombs, and what the only way is to truly check your heart before it's too late. Have you ever wondered if your peak physical performance is actually a shield or just a mask for a silent threat? To understand why a healthy engine fails, we have to remove the chest wall. When we study the anatomy of the heart, we see a muscle that requires more oxygen than almost any other tissue. To get this oxygen, it relies on a network of vessels that wrap around it, known as the coronary arteries. Early anatomists thought these vessels looked like a crown, which is where the name coronary comes from. But I want you to think of them like the root system of a massive tree. If one of these roots is severed, the branch it supplies dies almost instantly. We have two main players here, the right coronary artery and the left coronary artery. The left one branches into a massive vessel known as the left anterior descending artery, or LAD. In the ER, we have a grim nickname for this exact vessel, the widowmaker. The reason is simple geometry. The LAD supplies blood to the front and bottom of the left ventricle, the main pumping chamber of the heart. If you block a small twig, you lose a leaf. If you block the trunk, the whole tree falls. A blockage here stops the heart's ability to pump blood to the body, leading to massive tissue death. But how does a blockage form in someone who exercises daily? To understand that, let's look at the vessel wall. A healthy artery is flexible like a brand new rubber garden hose. The inner lining is called the tunica intima. In a perfect world, this lining is as smooth as Teflon. Blood cells glide right past it without friction. But life isn't perfect. Over decades, factors like high blood pressure, high blood sugar, and smoking act like sandpaper on this coating. Even the sheer mechanical stress of high blood volume during decades of intense training can cause microscopic scratches and tears. This is where the problem begins. Your body tries to repair these scratches. It sends LDL cholesterol to the site, like spackle to patch a hole. Then the immune system sends white blood cells to check on the repair. These cells ingest the cholesterol, turn into foam cells, and eventually harden. We call this hardened mixture of cholesterol, calcium, and cellular waste plaque. This condition is atherosclerosis. Now, here is the misconception that costs people their lives. Most people imagine plaque buildup like a clog in a sink. They think the pipe gets narrower and narrower until one day the water just stops. They assume they will feel it happening, that they will get short of breath, or feel chest pain as the opening shrinks. That makes logical sense, but it is biologically incorrect. If the human body is so efficient at surviving, why would it allow such a deadly process to remain hidden until the very last moment? The human body is incredibly adaptable. As the plaque grows, the artery wall actually expands outward to make room for it and maintain the opening for blood flow. This is called positive remodeling. It means you can have a massive amount of plaque, but the pipe itself remains 100% open. You have normal blood flow and zero symptoms. You can run a 10K and feel fantastic because the blood is still getting through. That is why the first symptom of heart disease in 50% of men and 64% of women is sudden cardiac death. They feel fine right up until the second they don't. So, what flips the switch? What turns a silent plaque into a deadly event. It comes down to stability. Imagine this plaque buildup like a blister covered by a thin layer of skin. This is soft plaque, filled with inflammatory mass. If you experience a sudden spike in blood pressure or extreme physical exertion, this thin skin covering the plaque can tear. This is a plaque rupture. When this plaque ruptures, its contents spill into the bloodstream. The body panics. It sees this as a massive open wound and immediately sends platelets to clot the blood. That is exactly what you want when you cut your finger, but it is exactly what you do not want in your heart. Within minutes, this clot grows so large that it completely blocks the artery. It isn't the slow buildup of plaque that stopped the flow. It is the sudden, rapid formation of the clot. It acts like a cork in a wine bottle. The blood flow hits a brick wall. This is a type 1 myocardial infarction. However, there is another scenario that often affects endurance athletes pushing their limits, the type 2 myocardial infarction. Let's consider a 50-year-old disciplined runner named Robert. Robert has normal cholesterol levels. During a race, he doesn't feel crushing chest pain. He just feels weird. His energy drops. He feels dizzy and nauseous. He thinks he is just dehydrated. At the hospital, doctors find a protein called troponin in his blood. Imagine troponin like the fluid inside a glow stick. As long as the plastic casing is intact, the fluid stays inside. But when you snap the stick, it leaks out. Heart muscle cells are full of troponin. When these cells die, they break open and leak into the bloodstream. Robert is having a heart attack, but when they look at his arteries, they don't find a 100% blocked pipe. They find a 50% blockage. So how could he have a heart attack even though the blood was still flowing? This is a problem of supply and demand. When you are sitting on the couch, a 50% blockage is irrelevant. The hose is kinked, but enough water gets through to water the lawn. But when Robert's heart rate spikes to 170 beats per minute, his heart demands the blood volume of a fire hose. However, the kinked artery can only deliver the volume of a garden hose. The demand exceeds the supply, and the heart muscle begins to suffocate. This is ischemia. In Robert's case, there was an additional factor: atrial fibrillation, AFib. Your heart runs on an electrical grid that creates a coordinated contraction. In AFib, the upper chambers stop beating and start to quiver. This chaos messes up the timing. When you combine a partial blockage with the rapid heartbeat of AFib, it creates the perfect storm. The heart beats so fast that it has no time to fill, and the arteries cannot deliver enough oxygen to keep up the pace. This illustrates the 70% threshold. Generally, you don't feel chest pain until an artery is about 70% blocked. Below that, your heart compensates. Above that, you might feel a tightness when climbing stairs that goes away when you sit down. We call this stable angina. It is your body's check engine light. But remember, the majority of heart attacks occur in people with less than a 50% blockage, because soft plaques are more prone to rupturing than large, stable ones. If the most dangerous blockages are the ones that give no warning, how can you ever truly be sure of your own heart's health? Your heart has a secret backup system known as collateral circulation. Think of your main arteries like highways. If a traffic jam lasts for years, your heart paves side roads to bypass the blockage. That is why a 70-year-old might survive a heart attack that kills a 40-year-old. The older heart had time to build these detours. In a younger person, the rupture happens suddenly. The highway gets shut down, and there is no way around it. One of the best ways to force the growth of these vessels is Zone 2 and HIIT training. Exercise builds the network that buys you time. And time is the only currency that matters. In the ER, we say, time is muscle. After 20 minutes, irreversible damage begins. After 90 minutes, Heart tissue turns into scar tissue. Scar tissue doesn't pump. To save the muscle, you have to recognize the symptoms. Men usually get the Hollywood heart attack, chest pressure, and arm pain. In women, it is insidious. Extreme fatigue, shortness of breath, or even severe heartburn. If you feel a sudden sense of impending doom, do not ignore it. Fixing the plumbing. When the plumbing fails, cardiologists perform a PCI. They insert a tube through your wrist, find the traffic jam with contrast dye, and inflate a balloon to crush the plaque. Then they insert a stent, a metal mesh scaffold that keeps the artery open forever. Now let's talk about scans to find the hidden culprit. The screening strategy. The goal is to find the fire before the house burns down. Standard blood tests only tell you the ingredients in your blood. They don't tell you if they are sticking to the walls. You need better data. The CAC score, a 5-minute scan for hardened calcium. A score of 0 is perfect. Over 400 is a ticking time bomb. The next scan is a CT angiography. This visualizes the soft plaque, the invisible, unstable blisters that haven't hardened yet. This is the ultimate early warning system. A heart attack in the seemingly healthy is almost always a tragedy of ignorance. Control your blood pressure to stop the mechanical tearing of your arteries. Regulate your blood sugar to prevent inflammation and keep moving. Don't guess if you are healthy. Use the technology we have and get certainty. If this breakdown of the silent threats inside your own chest has changed the way you view your fitness and health, please subscribe to the channel and leave a like. We uncover the medical truths that often remain unspoken until it's too late. Protect your heart, share this knowledge, and stay tuned. The next life-saving insight will be revealed soon.